Hi, I'm Chung from Taiwan.
Thank you for being here with us today. Can you tell us a little bit about your research?
My research is about to provide the evidence that showing the jugular venous reflux could influence cerebral circulation and plays a role in the pathogenesis of age-related neurological disease.
What is reflux exactly?
Which is abnormal flow direction in the internal jugular vein, which is the drainage pathway for cerebral venous system.
So, is reflux pathological then? Do you see it in normal patients or is it only in patients with CCSVI?
Yeah, actually in normal population, there is about 20% of people having the venous reflux. But with aging, we have found that the frequencies of venous reflux in internal jugular vein is also increasing. And also, the increasing rate is especially significant on the left side. So we think the etiology is still exploring. We don't know, but one of the etiology might be that the left brachiocephalic vein, which is downstream to left side internal jugular vein, is compressed by the tortuosity aorta, which is also more commonly seen in the elderly. So that might be one of the etiologies.
Why are you looking at an aging population?
As in the other countries of the world, I think with the progress of healthcare, we can live longer. So I think the age-related disease, for example, cancer, which maybe more people are concerned, dementia, strokes, cardiovascular disease will be more common than before. So that will have a burden to the society and the country. So we need to know the etiologies and to find the treatment for this age-related disease.
And in terms of how you're managing your studies, are you looking at a normal population as compared to an aging population?
Of course.
And are you going to increase that in time after having been at this conference, or do you feel that you already have an adequate sample size?
Of course, we need to keep going because there are still many problems need to be solved. So we will need more population.
So what will be the next steps in your research?
We might broaden our direction to basic research and animal studies because in human studies we cannot elucidate the causal relationship with the venous reflux phenomenon and the brain insights. So we will have more animal studies.
So you've come a long way to be at this conference. Why did you feel being here was important?
I think attending this conference is very important because it is such an encouragement. Because I think the people here really appreciate what we have done. That's an encouragement, so we have to be here. And also to let them know what we have already done may be helpful to them.
So have you found that having been here, will you establish new collaborations or take new directions with your research? Can you talk a little bit about that?
Yeah, it's very exciting that we have already established many collaborations. I'm a neurologist, and this meeting is really successful because it brings a lot of different field of people, neurologists, cardiovascular, surgeon, technician, and also eye doctors. So it will broaden our direction of research, and we can get the collaborations with them. That's really helpful.
Do you find that neurologists in China are more open to the theory of CCSVI than in other areas of the world?
Neurologists, to accept this theory, I think we still need a long way to go, even in our country. So keep going.
What have I not asked you that I should be asking you? What is important for you to tell us that we haven't asked you?
I think you have already asked very important questions. Thank you.